Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Plant foods can rid them of their benefits. Yeah, so many rich benefits, and it went into detail to talk about how processing of plant foods can make those great plant foods, which benefits our longevity and good health, can be robbed by processing. It's a very good article to read. It also emphasizes the importance of the investment of exercise. Two of the things that Darryl has strongly counseled us regarding for the last 5 years or so. So keep up the good work, Darryl. You're
Okay.
educating us,
I,
get us to live
I
longer, have healthy lifestyles. Yeah. So,
I appreciated that so much even before the article because I was moving in that direction, knowing that plant-based was so important with the impossible meat and things like that. But after being allowed to be a part of this auspicious group, I learned that that was not the direction that I should go in. And so I stopped that. And so I thank you. This ahead of its time.
well, well, many people have said that about Darryl, by the way, being precocious as a youngster and throughout the course of his life. Of course, your sister is younger or older than you, Darryl?
Older.
Oh, okay.
Older.
Yeah, his sister's a great teacher of Darryl's history, being a little boy to precocious as he was. Well,
You guys
okay.
knock it off. Just get back to the group session.
Yeah, that's the same way I felt about that recording. Okay.
No, but honor should be bestowed upon whom honor is due.
Okay, John.
No, there's only one that's worthy of praise and honor, and that's the Most High. It ain't us.
Right. Yeah, you said it right. Yeah. This is oh, by the way, we've had a number of articles throughout time, and sometimes we don't get to discuss all of them. So it'd be a good idea if any of you could identify some of those articles that we haven't discussed that you want us to discuss and send them to John Tatum and John Buchanan, and maybe we can have a session in which we discuss just those articles that we didn't discuss that were very important. Anyway, this is one of them that the 5 vaccinations that adults need beyond COVID and flu, because we all know about COVID and we know about the flu, but sometimes we forget about the other ones. So this is a very good article that puts into perspective the fact that you need more than COVID and the flu, and it articulates and enumerates all of those. I think that as you go down the line, you see, of course, we didn't have the RSV before, let's face it, so that's brand new. Shingles is something we've had for a while. Pneumococcal virus, measles, mumps, and rubella and tetanus are all ones that we've had, but they haven't been ordered. The RSV, and I hope everyone has gotten that one. Shingles is one that sometimes people forget about, but when you're over 65, it's a vaccine that can really help you. If you've ever gotten shingles and the pain and uncomfortableness that goes along with it, you appreciate the need for this kind of vaccine. Because all of us probably have had herpes zoster as a child, but it gets reactivated as your immune system decreases, and so you're susceptible to it as you get older. And so the shingles vaccine is good to get. Actually, my daughter just got hers. She became 50 years old a while ago, and she had some side effects of it, but it's an important vaccine to get. And then the pneumococcal vaccines, which are given over a period of time, are important because as you get older, your immune system wanes, and pneumonia is a source of morbidity and death for people who are over 65. So this the pneumococcal vaccine is important to get. It's a vaccine that is given over a period of time, like some of the other ones. And then the next one is the one that all of us get, measles, mumps, and rubella, varicella, and these things are recommended, but I think most of us get those. And they're long lasting. And then of course the number 5 is DVT, which is something that you get every 10 years. And people in the military, it's not an issue, but those people who are not in the military need to be sure to get it every 10 years. So those are some of the uh, vaccines that we need to have as we age, as our immune systems weaken as we age. Some of us are in the 60s, 70s, and 80s. And so our immune systems are in the process of weakening. And so it's important for us to get all of these vaccines. Any comments or discussions relative to?
I have a question, Doc. So recently there's been a new advertisement on the TV about a new pneumonia, or I don't know if it's the group of vaccines, but for seniors from Pfizer. And it kind of, the first, my reaction, it makes me wonder, if this is valid, if it's needed, and they say the same thing. As you get older, your immune system declines, and this you really need this to desensitize you against a whole group of new bacteria that can cause pneumonia. So I was wondering if you had seen that, or if you have any comment about that.
Are you talking about the pneumococcal vaccines? Those are the vaccines. Those are the pneumonia. That's what the pneumococcal vaccines are for.
Well, like I'm saying, Pfizer has a new one that's supposed to boost your pneumonia vaccine.
Well, I think that these are the approved pneumococcal vaccines. There's another one. I'm not familiar with it, but these, I think these are the ones, whether it's by Pfizer or not, that actually we use now, and they have been updated so that I would agree that yes, the pneumococcal vaccines are very important, and the older you are, the more important they become.
Thanks.
My question, Dr. Callender, is we have all these vaccines. What are the shots that we can take to build our immune system?
Well, actually, the things you can take to build your immune system are things we talked about all the time: sleep, exercise, and a healthy diet. I think many of the things that we have stressed are ways that you build up your immune system. And of course, the other things that we've all talked about, which are the mental exercises to keep your mind healthy. But exercise, sleep, meditation, all of those are build up the immune system. Any additional comments or thoughts on that?
Yes. Good morning, everybody.
Hi, buddy.
The number 5, the
Yes,
is that the one that children get when they're first born?
yes.
And you're saying we need to get it again? I don't.
Every 10 years.
Okay, I'm trying to. I don't remember getting it anymore. I have to look, but I don't.
Well, you should get it every 10 years.
Okay.
Because it got all three of those things in there: tetanus, diphtheria, and pertussis. Tetanus is, when I went to Africa, the number one disease in the hospital was tetanus. And that's a preventable disease. So the DPT is a very important vaccine to get. If you hadn't gotten it every 10 years, you should get it. So
Yeah.
When I go in for my annual wellness exam, my primary care doctor takes me through all the immunizations on this list, and so he makes sure I'm up to date. But I remember seeing all of these during my annual wellness exam.
any other comments?
There again, my annual wellness exam was a telecall.
Yeah, I don't. I think
I
I don't
need a
think
new
that's.
doctor, maybe.
Yeah, I think so. That tele exam is not desirable
Mhm.
for many reasons.
Agree.
Okay, Dr. Perez, you have any comment about the annual tele exam that they don't even see the patient?
Horrible.
Yeah.
Horrible.
Okay. That's a comment, all right.
I agree 100%.
Okay. Next one. This is an interesting article that talks about having high insulin levels, which is can be accomplished by eating a lot of sugar. By the way, and it's one of the reasons why they believe that Black women have more breast cancer than white women. But it's unclear as to whether or not that is related to our sugar intake, but it's certainly and associated with cancer in Black women. And it's cause for concern and makes us wonder about our sugar addictions, which many of us have, because that's one of the reasons why your body's producing a lot of insulin if you're eating a lot of sugar, and most of us are. Well, I should say many of us are. Any comments about that, this association? Darryl, any thoughts?
Yeah, I think that sugar, obesity, definitely plays a part, and possibly lactose intolerance with not being able to digest properly milk sugars.
Okay, it's interesting. One of the other articles was talking about the fact that many of the studies that are done in relatively young people. They aren't done in seniors, especially in older women. And so we need to have more studies that involve older women as well as younger women. Let's go to the next one, please.
I had a quick question, Doc. What is triple negative?
Okay, for every breast cancer, they do tests to find out whether you have negativity or positivity. And those people who are triple negative are people who need to have more aggressive treatment. And so they have the worst prognosis. And so every time they do breast cancer, they test you to find out to see if you're HRS positive or negative.
Okay.
And, uh, so that's what that is a prognostic in terms of what kind of medication you should get, whether you get progesterone or estrogen or radiation.
Thank you.
That's confusing because they say triple negative, and it sounds like negative means you don't have it.
No, it's a special designation for breast cancers, HER2 positive or negative, and it is one of the prognostic factors that determines what type of chemotherapy or immunotherapy you get, and whether or not you get radiation. So it's important to know whether you're positive or negative. But it has nothing. It's cancer, but it's whether or not you have HER2, HRS positive or negative. Now, this is an article that relates to hormonal treatment for menopausal symptoms. We have many studies that say that treatment with hormones, estrogen or progesterone, are not associated with increased cancer risk. But this is a paper that identifies that one of the studies shows that ovarian cancer risk is double. Formerly, there was a concern about breast cancer and other cancers. Now we've identified that those are not increased, but this study suggests that while that may be true, the ovarian cancer risk is increased. So those who bear the problems of menopause and have resisted the temptation to take hormones, this may be one of the reasons why they do it. Yeah. We just had a talk last week about ovarian cancer. Any comments and questions about that?
Dr. Callender, it seems like a darned if you do, darned if you don't. I mean, if you take estrogen, then your menopausal symptoms go away, but then you can get cancer as a result. It seems like
well, this is one study that says that. There haven't been other studies yet that have confirmed that this is the case, but your comment is an appropriate one. And that's why many people who have menopause don't take estrogens, and they deal with the hot flashes and all those other things that go along with it. But many of the studies have demonstrated that there is not an increased cancer risk. This is one of the earliest ones that identifies ovarian cancer as an issue. But your comment is appropriate.
Have we determined that hair relaxers can cause cancer?
There's an association with hair relaxers, and there's an article in this group that addresses that. There's an increased association. Some say that there's a cause and effect. Yeah. Next one. This study talks about one particular artificial sweetener, which is not one that is as commonly used as others. But this is that xylitol is one that does have an association with increased risk of heart disease. And this is to let you know if you use that cancer one that there is an increased risk of heart attack and stroke. Doesn't single out many others, although there are many. But this singles this one out as one that is very much associated with heart disease. So I don't know much about this particular one. I don't know if any of you have used it or not. It's not one of the most common ones, but it is. And see, if you're a diabetic, then of course sugar's out. So most people will then use sugar substitutes, which have their own issues.
Yeah, it may be a lot more common than we think since it's in sugar-free gums and sugar-free candies.
Yeah, that may be it. Good point. Okay, let's go to the next one. This is a surprising one, although many of you may have figured it out already because you have children and grandchildren. Being around kids raised as seniors, pneumococcal 6 foam. I know being around kids, you have more colds. Wasn't aware that being around kids increase pneumonia 6 times that normal, which is kind of surprising to me. Any of you grandparents been aware of this? Suspected this? Pearl, you have a comment?
No, not at this time.
Okay, all right. Any other thoughts? Any of you parents or grandparents recognize it?
I think being around kids in general, they are always catching something, so you have to be careful.
It sounds like this is a case of people with strong immune systems hanging out with people who have weak immune systems.
Yeah. Lucy, any comments on this? Since you're a pediatrician.
Yes, I felt pretty much the opposite, but now in my later years, and I think we talked about it before, that we felt that they having the exposure over and over and over again actually increased our immune system or mine. So I went decades with no respiratory, no infections because I was exposed to children, especially in the winter, with all kinds of bacterial and viral infections. So I built up my immunity over time. Now, in my later years, I'm not around young children with that concentration. So I'm not sure.
So were you surprised by this article?
Yes.
Okay, any other
And
comments?
I say that also something that we might begin to consider. More of us are living intergenerational. And I would have expected more of an impact if this was so. and I don't see it. We tended to separate it as it was related to COVID, but I'm seeing more intergenerational exposure and grandparents and parents, especially with the impact of rent and mortgages and childcare. So that even if they're not always living together, the intersection of generations is much greater. In this article would speak against that. Are you seeing that? Is anybody else seeing intergenerational living more?
Mark, you had a comment?
Yeah, just to touch on that last question, I do see intergenerational households happening a lot more, and I see the benefits from it. And I think from this very group that we discussed, some of the benefits of seniors hanging out with their grands and great grands, there's a tremendous upside to that. There's a tremendous physiological and psychosocial benefit that comes from it. So I see what this article is saying, but to me, it's in another group. We call it a nothing burger, meaning okay, we're just saying a whole bunch of what seems like common sense. Like if you hang out with people, okay, you're bound to get sick. I don't see where there's a bigger issue or a larger area of concern. Um, especially when you consider the upside to this. Okay, when you do hang out, when intergenerational households and family meetings happen, there's more upside than there is downside. This is simply saying to a certain degree, okay, you could get sick. Okay, well, that's with any group gathering. You know what I mean? Like, I don't think that this is, unless I'm missing some significant data and science in the article, I don't see where it's a tremendous warning to say, hey, no, don't do this because there's other data that says we should do this.
Carol, you're next.
I agree with Mark. I was thinking for our mental and mainly our mental and staying younger, when you associate with younger children or a younger generation, you're more alert to and you have a better mental and even physical outcome than if you just hang around just with your peers all the time and not try to stay abreast with the younger generation. There's a disconnect.
John Buchanan?
Yeah, I was thinking, so is there a pneumonia bacteria, or do the other diseases that the little kids have cause pneumonia?
Yeah, they do. Yeah, it's well known that they carry a lot of, as you mentioned, that they get a lot of infections. I think it was Betty mentioned. And so you are more susceptible if you're older and you have a weakened immune system. But this is an interesting one of the first that identifies the sixfold increased incidence of pneumonias in older people. So,
being a teacher for 35 years, I think I had the flu twice in 35 years, and that's being around thousands and thousands of children. So I'm.
But you weren't necessarily a senior when you were many of those years.
True. But I'm tending to think that exposure, like Mark was saying, builds rather than destroys.
Carol, you had your hand up again.
One more statement about immune system. I remember when John got his first transplant, even though he was in his 40s, the doctors sort of like pushed him to go out, and he was teaching on the elementary level. And everybody knows that when you're on the elementary level, there are germ, they'll used to say they're germy children. Children just carry germs, period. And I remember another colleague that didn't work in the schools, but after he got his transplant, he always had his mask on because about the immune system, and he was overly precautious. And I don't know what his body and the transplant just didn't gel, but he died earlier. And he took more precautions, even had a note on his door that he had a lower immune system. And what precautions, if you had a cold, don't come near me, or etc. Then I see other transplant people, after they get their transplants, they're not as cautious and they get back in society. So there's something to say about this, building up your immune system. Because you can't tell your grandchildren, don't talk to me or come near me because you have a lot of germs.
Oh. Actually, you can, but you don't want to. Mark, you had another comment.
True story, and I'll try to summarize it pretty quickly based on what was just said. A mother had three daughters, one after the other, of course. First daughter, the firstborn child, they they read all the books, they sterilized everything. If the nipple to the bottle fell on the floor, they just bought a new one. You know what I mean? They washed their bottles and everything, their environment religiously. It was very sterilized. Second child, they relaxed just a little bit. If the nipple fell on the floor, they just kind of give it a good rinsing, and and kept it pushing. And they did some sterilization, but not as much as the first one. But the last daughter, she jokingly said that she just kept it pushing. If the nipple fell on the floor, they just kind of wiped it off, kissed it to God, and kept it pushing. And she noticed later on in their lives, the three girls are adults now. She says it's the first one, it's the oldest one that gets the sick. She gets sick most often. And the last one, she seems to be, pretty ruddy. She seems to be pretty sturdy as far as her health system and everything. But take of that what you will. That's not scientific or medical, but that's a true story, though.
Thank you, Mark.
Yeah, well, the operative word is that it was a story, meaning anecdotal, not scientific.
But in my comment to what Mark said is, if you ask almost any mother of several children, that is the story, the way they act. You are cautious in the beginning, and I guess you figure you learn more. I don't think you're really thinking about the kids. You learn more. So you don't do all those things you did with the first one. So I think that story is probably true with most mothers.
Right. And
Very
there's probably a story about the youngest child being a victim to some immunological diseases where they got sick. And the eldest child was the least healthy, but that's the problem with stories. You can find stories to match any scenario you want.
Okay, well, thank you all for sharing. Let's move on to the next one. This is an article. ART means that artificial reproductive technology. As you know, we have many ways that we have children born these days. And so the question was, are those kids at a higher risk for cancer? And apparently they are not. We do so many things differently now. They did find that there was an increased incidence of leukemia, but they aren't positive that this is the reason for it. So that was the only one that they found, that there was an increase in leukemia, but there wasn't enough data to say that it was statistically significant. But in general, the answer was that in spite of us using artificial technology to have children born cancer was not increased in those situations. We certainly are doing more IVFs and in vitro fertilizations and other procedures now compared to how we used to. But so far, it doesn't seem as though there's increased risk to pay. Dr. Perez, any comment?
I had a question, Dr. Callender. I'm unfamiliar with the ICSI intracytoplasmic sperm injection.
Yeah. What is your question about that?
I'm unfamiliar with it. What is that about?
Just taking the sperm and putting it into the cytoplasm of the ovary. I mean, of the egg, of the ova, the egg. Because you have, and that actually is in vitro fertilization. It's a type of it in which you just take the sperm, or in in vitro fertilization, you take the sperm and inject it into the uterus, or you can do it right into the ova itself, the egg itself.
Oh, okay.
Yeah.
Thank you.
Sylvia?
Yeah, Dr. Calder, is there any, good morning, everybody. Is there any research pertaining to those individuals who have their, I guess you said their cells or sperms frozen, and then later on,
That's what
the
this
length
is.
of time that they're frozen and then later on inserted?
That's what this is about.
Uh-huh. So those that are frozen also, I was just thinking that this was pertaining more to, doing it like right now versus over a sperm that may have been frozen for 5 years or more, and then,
But
some
most of those are frozen. In other words, they don't just do it right now and then, but they take the frozen sperm and inject it.
I see.
And that's what in vitro fertilization is all about. For the
Yeah,
most, and they have not differentiated between those that are done, immediately and those that are done that are frozen. So
oh, okay.
there's not
That's what I
difference
was.
between the
Okay.
two. Yeah. Because
Thank
see, as you're pointing out, there's a situation where you have somebody's actually they take the sperm immediately and they do it, and then they are those that they freeze, and they have not differentiated between the two.
Uh-huh. Thank you.
Okay, if there are no other comments, we'll move on to the next one. I put this in here because very often, as a physician, I'm not an oncologist, I'm a transplant surgeon, but oncologists can sometimes be cavalier. And this is an article that talks about how this oncologist recognized that he at one point was not as sensitive to the patients and did not give the patient, he did not meet the patient where the patient was. This is a patient who's a mother whose son was dying. And all he talked about was the fact that there's no hope, rather than dealing with the ways in which you can optimize and maximize whatever days that remain for the person, and emphasizes the importance of hope. As a transplant surgeon, I pretty much had a similar situation when I started off in transplantation, because in those days the success rate was about 50%. I mean, half the people that we transplanted survived and half died. And so for many, they thought that kidney failure and kidney disease was a hopeless situation. And so one of the things that I thought that I provided was hope, and the fact that more emphasizing the success of transplantation rather than the dire aspects of it. And similarly, this doctor recognized that one of the most important things that you can give a person who is facing death is hope, and a way to optimize the time that they have left, rather than dealing only with the negativity and the negative aspect. And so this article is all about emphasizing the hopefulness and the fact that people who pray and people who have hope are more likely to survive than those people who don't have hope. And so, and I think that this is a lesson that all physicians need to learn, to recognize that their role is not only to let you know when you are going to die, but also to take advantage of life while you have it, and not to give false hope, but to give hope and optimize the days that you have left. And I think this doctor, over time, recognized that when he was younger, he was more of a fatalist, and recognized that that's an aspect of, of, of his practice that evolved over time. And he's sharing that with others so that they would be more helpful and hopeful as they took care of patients with diseases that had a very likely fatal outcome. I thought that was the essence of what this article is all about, recognizing the importance of giving people hope, not false hope, but hope of taking advantage of getting the most out of their circumstances. John Buchanan.
Yes, I I'd never heard that term palliative care until dealing with my mom's the end of her life, and I thought it was interesting, to say the least, that they had a team at the hospital to counsel me as a primary caregiver about what was, in the future. And it helped me quite a bit. I don't know if I was fatalistic, but I had a lot of fear. So I think that the hope that you're talking about is really important. And I had, again, some periods where there was a lot of hope, even though, excuse me, even though dementia, especially Alzheimer's, is like a slow motion train wreck. To watch that is very challenging, knowing that you're powerless to stop it. You might be able to slow it down a little bit, but they had a team, the palliative care team, helped to prepare me. And I thought it was that, again, I never heard about it before this. So, has this been going on for a while for palliative team?
Yes, at least the last 20 years. But it has been intensified and recognized as a very important aspect of patient care. One of the things they recognize is that most of the healthcare dollars were spent trying to take care of patients in the last 6 months of their lives. And sometimes they felt that it was futile. And so they felt that it was important to emphasize accepting for some that we should do things to make them comfortable, more comfortable as they die and as they live. And in some circumstances, this increases their life. But one thing for sure, it makes the end much more comfortable. And that is why palliative care has really become very important and has intensified over the last 10 years. Betty?
Yes. Since they have instituted hospice, and I'm not so sure exactly how long they've really had hospice, but since they have instituted hospice, I think some of the conversations about hope have gone down somewhat. And I'm just going to throw in a couple of instances. When my son was kind of given up on as far as being able to help him, a doctor didn't even come in to see me. They sent the hospice person saying that they were going to put him in hospice.
Wow.
Okay, that's one incident. But just recently, one of the members of my church, former church, passed away. And at her funeral, her sister made a statement when she was making her remarks. She made a statement that the doctors had told her sister, we're putting you in hospice. And the sister said to her one sister, the good sister said to the sister patient, I understand you're going to hospice, do you know? And the sister that was sick said, yeah, I know what hospice is. And I think hospice nowadays is just saying you're at your end. You know, it doesn't always mean that, because I've known people who went into hospice and eventually they took them out of hospice because they did so well. But just the word itself just makes the person think that this is the end. So I love this article, but I don't think it's being done as much now that hospice is a part of the end process.
Janice? You're on mute.
Question. What's the difference between hospice and palliative care?
Well, okay. Hospice is a situation in which they identify that that it is likely within 6 months that you're going to die, and so they try to do things to make your life as comfortable as possible. That is true, and so just as Betty has said, that many people interpret the fact that they make you comfortable as it is the end. But as she has mentioned, doctors don't know everything. Sometimes they're wrong, and it's not the end. But the real goal is to is to not administer futile care, which means that if there's nothing else that we know to do, then what we should do is to make you comfortable so that you don't suffer. And that's what palliative care is all about: is to relieve the suffering, minimize the suffering that you go through. And one of the negative aspects of it is what Betty talked about, the fact that some people, they didn't know that they were that sick. But when they tell them that you're going to hospice, they then, for the first time, may recognize that, hey, that means I'm going to die. And so that is the other side of the issue. It is well meant to try to make people comfortable as they die, but on the other hand, it is a death sentence. Janice, did that answer your question? Or?
Not totally. Sounds like he spoke more about hospice. The reason why I say this is my sister had ovarian cancer, And during her treatment, she started going to another doctor. The original doctor left the area. And the second doctor, she just couldn't connect with that doctor. And she felt that he was more aggressive, abrupt. She had an opportunity to visit the original doctor and said that, and said she just wasn't comfortable, not so much the treatment, but his way of presenting different alternatives to her. And the doctor said, the first doctor, we realize that he just hasn't found that sweet spot yet as to how to communicate with his patients, but be patient with them. I think after that, maybe someone said something and he became a little bit more lenient. Then at some point he told her, I think it's time for you to have palliative care. He didn't explain it, and she looked at me, and I went with her to all her appointments, and she's been functioning and doing well. And she said, no, I don't think so. She said, we'll keep doing what we're doing. And within that week, she became quite ill and was admitted to the hospital, not because of the ovarian cancer, but because of, she had a brain aneurysm. And she remained in the hospital unresponsive for more than 30 days. And the family just often wished that he had said more, did more about this palliative care. Would that have identified the brain aneurysm or identified that her health situation was worse? I just never understood the connection between the two. I know with hospice, it makes you comfortable into death. There is no hope. That's what I think hospice is. But I still can't quite figure out the palliative part. Is it the same?
That's what it's all about. It's just to make you, palliative means that we're going to do what we can to help you be comfortable. And that's what palliation is all about. And it does not mean necessarily that it's the end, but it suggests that since we can't, in other words, futile care is when we give you a lot of care that doesn't do any good to you, because there's nothing else we can do. Palliative care is care that's given that tries to make the most of the situation so that you are comfortable as we do the best that we can. But it also recognizes that it is likely that in spite of what we do, you're going to die. And so our effort is to make you comfortable. And so the emphasis is not on so much saving your life as it is on making you comfortable as you move towards death. That's the emphasis of palliation. Whereas treatment for cure is different from palliation. Treatment for cure is the expectation that you're going to make it through. Palliation is the expectation that you're not going to make it through. And so we're going to do what we can to help you while our treatment is not likely to pull you through.
Okay. Thank you.
Darryl, you had a comment.
Yeah. Just did a Google search, and it says palliative care is for anyone who has a serious medical condition, while hospice care is for those who are at the end of life. Palliative care is more often available at a facility such as a hospital or clinic. Hospice care is more likely to be available in your own home. Both palliative care and hospice care provide comfort, but palliative care can begin at diagnosis and at the same time as treatment. Hospice care begins after treatment of the disease is stopped and when it is clear that the person is not going to survive the illness. One of the major problems with palliative care is a common misconception that palliative care is only for the end of life patients, and it's the same as hospice care. But I just read through the difference where it's not end of life is hospice. Palliative care can be done at the same time the treatment is done. And in case, here, Jimmy Carter is an interesting example of hospice care. He's been in hospice care for over a year. He's at the end of life, but he's kind of exceeded expectations of that 6 months. So he's trying to set the record for how long can you go in hospice care.
Right. Good. Thanks, Darryl.
Any other comments? I think that's okay. Let's go to the next one.
One thing that I think is important is the cultural importance of end of life to people. And I think that there are new entities, they call them end of life doulas, to put back into more the hospice end of life as opposed to palliative care component, that the cultural sensitivity is so very important. And I think we've pushed the envelope in that direction, so that the hospice care is even more palatable than it previously was.
Okay, let's move to the next article. Thank you for a great discussion. This is an interesting observation that tests may predict dementia up to 9 years before diagnosis. You kind of wonder why you want to know about having dementia 9 years before diagnosis when we don't have a treatment for dementia. And so you have a new test that diagnoses of dementia, but who wants to know 9 years before? And if so, this may become important when we have actually a treatment for dementia. Right now, getting a diagnosis of dementia 9 years before the fact, then it becomes debatable about what is the importance of it. Now, when we get a treatment for dementia, that would make it a lot different. What are your thoughts about it? This is an interesting article that makes you wonder, do you really want to know 9 years ahead of time that you're going to get dementia? Sylvia?
I don't know. I think I would probably want to know because, if you know you're not going to live till tomorrow, you're going to be doing things a whole lot different than you would normally do. And I guess you can never prepare for death, but you can start doing some things that put things in order. I guess that's what I'd be thinking.
Why did you say you can never prepare for death? Because we're all dying.
Well,
So
I know we're going to all die. I know we're going to all die. I know we're going to all die.
But no man knows the day nor the hour.
I do know that. But I'm
we're-
thinking that I need to get things in order. I need to do some preparation. That's what I'd be
I'm
thinking.
87. That means I'm going to die soon. So,
No,
but at 70, you know that too. At 60, you do also. So we all
Yeah.
have a death sentence. So when you say you can't prepare for death, yeah, you can. Some don't want to, but you can prepare yourself because you know if you're born, you're going to die. So
yeah. And I didn't say you can't prepare. My thing is I would be trying to prepare. If I got information like that, I'd be trying to prepare for death.
but I guess my point is we're all dying. So all of us have a death sentence. So we should all be preparing.
Yeah.
All,
I mean,
all the while.
yeah.
But anyway, that you expressed your point of view about that though. So that's pretty clear.
Okay.
Yeah. Carol?
When my mother was told that she had dementia, she was fretting about it. And I just simply said, and when you have it full blown, you won't remember this anyway. And then she had to chuckle because I was trying to lighten the air. But since they didn't have a cure, they were giving her some medication. Later found out, and I recognized that medication wasn't doing a doggone thing. But you just go and you take life, and the people around you can adjust so they don't get on you and start fussing. Don't you remember? I just told you a few minutes ago, and etc. So, and Dr. Callender, you referred me to a geriatric doctor, and I sort of froze or freaked out when he told me to count by threes from 100. And I'm going, oh no. So backwards. And so the other day when I was talking to my daughter-in-law who's in her 40s to count by three backwards from 100, and she did it at such ease, no problem. And she was getting down to 70 and could have kept going. And I'm going, oh no, I must really have it. And like you just said, the point of it to know, and there's no cure. In fact, you're just going to cause greater harm because you're going to worry and there's going to be stress, and that kills you too. So I don't know. Sometimes we say you shouldn't know, and sometimes you say you should know, because when you know you got a fatal disease and there's no cure, or you got a fatal disease and you might have hope. And then we're going back to that other article about having hope. Sometimes you say, why do you have hope? Even in education, they tell kids, you can be anything you want to be. And you know, this kid at the bottom of the class, and he wants to be a nuclear physicist or something like that. And you know, there's no way that they can be that unless they're evident. But our society says you should have hope about everything, the educational. But anyway, I'm rambling. But I don't think, yeah, if you know, then what can you do about it except for quit all your job, quit what all you're doing because you think you have dementia and your Bible, and you're just killing yourself even off faster. Okay.
Darryl, you're next.
Okay. I think everybody on this panel wants to postpone all the bad stuff as long as we can. That's why we're on the panel. Dementia is part of the bad stuff. So, we've been talking about ways to postpone it, eating better, exercise, and stop smoking, stop drinking, and learn to play piano. I think all of those will put those 9 years to maybe 15 or 20 years.
Okay, any other comments? Okay, well, I think we've had a good discussion on that topic. Any other, if not, we'll go to the next one, which is a medication that before there was no treatment for MASH, which is the medical name for steatohepatitis, which actually was not reversible. And if you made that diagnosis, you're going to need to get a liver transplant. This new medication now says that steatohepatitis actually can be treated. And so this is a breakthrough to know that some of the people who actually died and actually had liver transplants, in some instances, this can be reversed. And so this is a new drug that has come out and is a breakthrough, so that people who have steatohepatitis, which formerly was untreatable, now it is now a treatable disease, which is new. And though that was to alert, some of you are aware of people who have had steatohepatitis who died from it, and who or either had liver transplants for it. And so this is a new breakthrough medication that can reverse a disease that previously was irreversible. So that's why I put that in there, so that as time goes on, and you talked about hope, diseases that formerly were untreatable now become treatable. And so So to me is the only positive side of knowing, for example, that you might have a disease like dementia that, as Darryl talked about, the many things that we do to prolong our lives and actually delay the onset of dementia become critical. John Buchanan.
So here's one of my least favorite words again, which I still don't understand. Agonist, monoagonist, as opposed to antagonist. I don't know. Can you help me with that?
Yeah, antagonist is something that goes against something. An agonist is something that's supportive and protective of. So when you think of an agonist, and that's what this therapy is it's a therapy that actually, and this is something that has been a drug that's used for diabetes and for obesity. But now we have another use for it that it actually treats steatohepatitis, which was formerly untreatable. Any other questions or comments? Okay, well, let's go to the next one. This is a blood test that now is able to differentiate between a cerebral hemorrhage and a stroke that is caused by a blood clot. And the blood clot is treatable now by taking out the clot or dissolving it. And so this blood test that they're talking about now, GFAP test, is confirmatory of a blood clot, which is then treatable, in contradistinction to a cerebral hemorrhage, in which is less likely to be treatable because you don't have a clot that you can take out. And so stroke can be a blood clot or hemorrhage. And this test differentiates between the blood clot and the hemorrhage. And if it's a blood clot, it then allows quick diagnosis and a treatment, because every minute that you have where you have a blood clot and the circulation is not there, you lose at least 1 million brain cells. So this is so we're in an era in which we're coming up with new diagnostic entities which allow treatment. And that, of course, is important, as we just talked about the difference between palliation, hospice, etc. And so we're now getting more and more ways of making diagnosis of treatable diseases. And I think that's what this is all about, that we do have a new blood test that better differentiates between the blood clot and the intracerebral hemorrhage. Any comments? Because I'm using medical terms, and maybe you can help me make it clearer if you don't.
Dr. Callender,
Yes.
I'm like John Buchanan, and then I just thought about it. The terminology and why it has to be explained to us. In music, all of our symbols and everything are Italian, like P for piano being soft and etc. So you really have to know Italian or taught what the Italian words are meant. Medical words, what is the root of this? Is it Latin or etc.? Because none of these words in English make any sense.
Latin.
Latin.
Latin is Latin, but I try to make it simple by saying blood clot or hemorrhage, because that's what, when you have a stroke, you have either a blood clot or you have hemorrhage in the brain. So that's how we break it down. But a lot of the words have Latin derivatives.
Okay, thank you.
Dr. Callender, I had a question when you start talking about blood clots. And, you know, in the hospital after surgery, they give you, I think medicines for blood thinner.
Yes.
And so if someone has a major surgery, do they do this test before they put them out the hospital? Because nowadays you don't stay in the hospital long. Having a major surgery and then they send you home, and then someone has a blood clot. I mean, do they do this kind of test before they put you out the hospital?
Well, I think that what you're talking about is a very important concept, and that is that after any surgery, often they will put you on blood thinners, or they'll have you do pedal exercises that circulate the blood, and they do all of this and actually get you to do the pedal exercises so you don't get blood clots. This, though, is a test for somebody who has headache or other symptoms that are suggestive that they may have had a stroke. And a stroke can be either a hemorrhage or a blood clot. So after surgery, they do put you on blood thinners and they do have you do pedal exercises to prevent you from getting a clot in your legs that will then go to your lungs and cause a pulmonary embolism or blood clot. So, so in many ways, to answer your question, do they do blood tests like this before you leave the hospital? No. But what they do is they either put you on a blood thinner right after the surgery, or they have you do exercise of your legs that prevent the clot.
I see.
So that's my answer to your question. Does that answer your question?
Yeah, I was just thinking about how they put you out the hospital as fast as they can, and if there's a possibility of blood clot, but like you're saying, the blood thinner medicine would and exercise could help prevent it, any kind of problem.
Right, yeah, but I think your point emphasizes if your doctor operates on you and sends you out of the hospital without those things, you could develop a blood clot, and that is a concern. It's a legitimate concern. Any other comments? If not, we'll go to the next one. It's interesting. What is long COVID? And this is how the National Academies have come out with a new broad definition of what long COVID is. And you can read it here, and that it gives you a time period over which you have these symptoms with shortness of breath, rapid heartbeat, fatigue. And if it lasts longer than a month or two, then that is, and actually 3 months, it's called long COVID. And the reason is because so many people have had different ways of defining long COVID. And so they wanted to make it clear so that if you have these symptoms and you have it for longer than a period of a month of 3 months, then that then qualifies for long COVID. Now, what does the new definition mean? Well, it just means that you actually then know, and I think some of you told me about some of your friends who've had COVID for a very long period of time. And this then quantifies and qualifies them to say they have long COVID, and so the treatment can be done. Any of you know people who have long COVID? Some people have had COVID and have long lung disease. Kidney disease is one of Darryl's friends who just got a transplant who got kidney disease from the COVID. And he qualifies into that category. Any other comments or questions about long COVID? Anybody other than Darryl have people who have long COVID? Okay, well, I guess most of them are fortunate. Well, we survived COVID, so I think God has blessed us. Next article. This is interesting because this is talking about the permanent makeup pigments linked to allergic contact dermatitis. It doesn't talk about the fact that the laxatives are associated with increased instances of cancer. But this talks about the allergic dermatitis that is often experienced. How many of you ladies use permanent makeup? Probably many of you. No?
I never have.
Okay. All right. That's interesting. I
Since COVID, I barely put on makeup anymore. I mean, you weren't going out, and even now we go out, I don't even think about makeup anymore.
How many of you women feel the same way?
I never have used makeup. I guess my mother was old school. She didn't use it. She used to take the tube of lipstick and tap her chin and rub it in a little bit. But other than that, she didn't use any of it. She put a little on her lips. That was it. But I never have. Put a little lotion on. That's it.
That's interesting.
I used, especially when I was working, or maybe now if I got to play for church once in a while, but during the week, no. But I love that permanent lipstick that you could put it on and it lasts for 24 hours and you didn't have to be bothered with it anymore. Because if I put it once on in the morning, that's it. But then I've heard that something was wrong with it. So I tried not to put that on much. Then I was sitting next to someone at event and choir was singing, and we looked around and it seemed like women are putting on less lipstick or not wearing any lipstick or hardly any makeup at all. And I was wondering, is this a trend that's coming about? Has anybody else of the women, I know men don't really care, have you noticed other women not wearing makeup as much?
Well, I know my wife wears makeup. So.
I think it varies. I think it's the opposite. I'm seeing more makeup. I don't do the permanent makeup either. But, oftentimes now, Carol, when you go out, like you said, that permanent lipstick, uh, nowadays, especially with the younger ones, it's the eyes and the I guess liners, and they appear to be over made up. And all of them,
yeah,
yeah.
especially the younger ones. Huh?
Yeah. I see it more in the younger ones.
Yeah.
Yeah, fake eyelashes are getting real popular,
Mm-hmm.
and yeah,
Fake everything.
if I just had a few wishes, I would wish that women stop wearing makeup. It's not regulated by the FDA. There's so many toxins in makeup. There's a lot of petroleum products in makeup that wreck the endocrine system, and it blocks your pores. And truth be told, most of the time women are wearing makeup for other women. Because in a lot of cases, like what a man cares about, if you smile at a man, that is the best makeup because he thinks you're interested if you smile.
Elizabeth, what do you have to say?
Good morning, everyone. That is the joke of the day. I'm gonna say one word, doctor. I mean, two words, doctor. Callender, Jasmine Crockett, and Margaret Taylor Greene. That was from the congressional hearing. That was a big thing about from the congressional hearing where one congressman criticized Jasmine Crockett. eyelashes, false eyelashes, and it went viral.
Yes, it did.
So
Yeah.
it goes
So
to, I think it was Janice that talked about the younger people, when we are among seniors, you see maybe a dab of lipstick or something, but you don't see all that when you look at some of the older group, okay? I mean, some of the younger group, then you see the false eyelashes and all the
And
other
everything
things
else.
that they call glamorous.
okay,
Yeah.
I gotta say something. There are a certain group of people in this world that need makeup desperately because if you don't see them with makeup, you will scream and you run away with your hair on fire. But then there's another group of people on this earth, most of them that are on this group panel, that don't need it at all.
Yeah.
Mm.
And his point is well taken because it's interesting if you've got a lot of pigment, you don't need a whole lot. If you have little pigment, you may need some.
Oh, thank you for saying that, Darryl. I appreciate the fact that I don't need any makeup. Thank you.
Well, wait a minute. I can't let men off the hook just because they don't put on false eyelashes. Well, some of them do, but you'll find them trying to transition over to others. Well, but okay, men. A lot of y'all use shave cream. That's also not regulated by the FDA, and that it soaks right into your pores. And a lot of the stuff in shave cream, you got to watch the ingredients because it could be very toxic.
Okay. Next guy, which will probably be the last one. Next item.
What I got one more question.
Yes.
Just polling the men. Do you care about women's fingernails and toenails? Is there anything about that? You see some women with these long fingernails polished, and I realized before COVID, I was getting my nails done all the time, and that harsh fingernail polish that they use they shape. I forgot the name of it, but it's permanent and all that kind of stuff. But do men really actually look at ladies' toes to see if they're painted or their fingernails, how long they are, and what they look like, and all the jewels on them?
I do.
Yes.
I like I like the colors, but I don't like the long nails. I think they're ugly.
But do we
I,
look at them? Yes.
I do look at them and I appreciate the efforts. It's because I often think of it like a Christmas tree. Every body, every human body is a tree. So the efforts that women make to go and decorate that tree, to ornate that tree, is appreciated. It makes it a better look overall. So I'm one of the ones that do pay attention to the details that women do and make.
I agree.
Okay, on the point system, I think that smile coming my way, that's a lot of points for that. But on the other hand, even though I can appreciate nicely made up toes and fingernails, kind of low on the point system, as opposed to somebody actually expressing some interest in me.
Okay. Let's go to the next slide, which will be our last one. This is interesting. Chronic kidney disease and tooth loss after menopause, which is something that is, I guess you see many people who have false teeth these days, and many of them related to many conditions, although one of the most common is the caries and the not taking care of the teeth. But apparently there is an increased likelihood of losing teeth after kidney disease and menopause. And this is something that most of us don't recognize because people nowadays have such great dentures that you hardly recognize people are edentulous. Any comment about that?
Dr. Callender, is it true that when women are pregnant that they lose their teeth sometimes?
I'm not aware of that. I don't know. I've not heard that.
In answer to your question, John, I had my kids at a very young age, and I did lose teeth. And the doctor said something about calcium or something that made my teeth come out. But my back teeth, I lost several of my back teeth when I was very young because that's what they attributed it to.
I know that usually whatever the baby needs, so if you are insufficient in anything, it will be drawn from you to the baby in utero.
Maybe
So that's why prenatal care, being prepared even before the pregnancy is so important.
Before
that could have been it then. I wasn't totally prepared, I guess.
Yes, Dr. Callender, I was told the same thing. So.
Okay. All right. Well, that takes care of today's event. Thank you all for attending and being so outspoken. That one thing about this group that is unique is that people will freely express their opinions, and we learn from each other. So don't change.